Hi, my name is Sarah Terry, and our Module 7 assignment had us read a meta analysis and to provide our own analysis. So, this is my take of the effectiveness of cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, was developed by Aaron Beck early in the 20th century. It has become the most researched form of therapy. Our text explains that well adapted people use our cognitive, affective, motivational, and behavioral systems to meet our needs and provide protection. However, inaccurate thoughts and beliefs lead to maladaptive behaviors and emotional distress. So, with CBT, by countering the negative automatic thoughts, it helps people conquer their distorted thinking and replace these thoughts with more positive and healthy responses. The relationship between the counselor and the client is collaborative, it's action oriented and direct. They use a variety of approaches that can include complementary modalities like pharmacology, exposure therapy, and family and individual counseling. CBT is more structured than most talk therapies. They hope to provide the client with the skills that they need so they can become their own therapist with long lasting results. After reading the meta analysis for our assignment, it's titled The Empirical Status of Cognitive Behavioral Therapy, a Review of Meta Analyses. It was composed by Andrew Butler and his associates in 2006. I was intrigued by the information that they provided on the effectiveness of CBT, and I also appreciate that they explained what a meta analysis is. A meta analysis is compiled data, which is also from compiled data. So their study included 16 studies, which gave a much larger number of test subjects and from different treatment approaches. So these 16 studies all included in total 9,995 participants, and the data compiled were from 332 different studies. The design of their study were to magnify and categorize the effects of CBT on a larger sample size with using both controlled and uncontrolled studies and using different treatment modalities. Though there are some limitations to using a meta-analysis, these authors did a good job reporting on trends they found and added their own suggestions for further research and investigation. Most studies analyzed were based on research for CBT with their effects on depression and anxiety. But they also included results for certain phobias and other mental, physical, and social disorders. Although the effectiveness of CBT has been thoroughly researched, there are still pending questions remaining about its effectiveness compared to other treatment modalities, the nature of the control groups, and its long term effects after treatment is complete. So, these were the goals of this meta analysis. So, CBT and depression provided the most extensive studies to analyze in their research. The authors noted the potential of researchers' positive biases, which was interesting to read about, which means that the researchers could favor the CBT modality and design their studies to make the data reflect their opinions. But the results from several of their studies did find CBT to be superior compared to a wait list or placebo controls. But there was not much difference between behavior therapy and other bona fide modalities. A few other studies detailed the use of pharmacology, which specifically showing how serotonin reuptake inhibitors were equally as effective as CBT. However, when medication and therapy were combined, the results were significantly better, especially compared to using either method alone. Studies that involved children were limited, but most available did favor CBT over a wait list or relaxation and supportive therapy, and was far better than placebo pill trials. Analyzing the long-term effects of CBT was beneficial. Just to know recovery in any means is a long-term endeavor, and changing behaviors takes time to learn, practice, and utilize. So 5 out of 8 studies showed CBT as a preventative measure against relapsing. So comparing CBT to antidepressants, only 29.5% relapsed after the CBT treatment was done, compared to the 60% on medication. The authors also added that there is only a 31% chance of relapse when CBT and medications were used together. So treating mental and physical disorders with CBT, their results were smaller compared to the previous depression and anxiety. But to use cognitive therapy actually did improve anxiety, which was better than those on a wait list or with no treatment or pill placebos. And it also provided longer lasting results compared to medication only treatments. Panic disorders and social phobias also improved using CBT, which they believe because of its cognitive restructuring techniques. However, those that had social phobias had better results when it was combined with medication. Individuals who suffered with obsessive compulsive disorder and post-traumatic stress disorder, they found CBT to be just as effective as response prevention treatment. And also trauma-based CBT was found to be very effective for those with PTSD. They also had reports for treating schizophrenia. And after CBT treatment, they found decreases in delusions and hallucinations. But those who did therapy along with the recommendations for medication, they had large changes in symptoms compared from pre to post-treatment results. They also use CBT methods for marital distress, anger, bulimia, internalization disorders, and sexual offenders. People who experienced chronic pain also improved. They had better coping skills when experiencing pain and decreases in their behavioral expressions of pain. So, conclusion. Alrighty, so this analysis provided by Butler and his colleagues was an analysis of other analyses, and exploring the effectiveness of cognitive behavioral therapy on multiple disorders. But their results showed to be promising and had the potential for long-term success. The results from the different studies had the authors recommend future research on other disorders, also to continue monitoring the long-term effects, and specific research is needed to compare CBT to other treatment methods. So, my conclusion reading this article showed promising results, especially for treating depression and anxiety. The authors included multiple studies that combine medication, and although it can increase the cost and require more monitoring, it showed to be more effective. Now, a limitation that I found is that this article was released in 2006, which is considered outdated. I conducted my own research for more recent studies on the effectiveness of CBT on different psychological disorders. A study I found from 2023 utilized internet-based delivered CBT. Since the beginning of the pandemic, therapy became very difficult to obtain, and once the internet became available to provide as a medium of transition, then therapy was able to reach new boundaries. There is limited research on this method since it's a relatively new concept, so there is lacking of long-term results. But the designs of this study had the participants receive specific modules based on their needs, and they were given different surveys throughout the study and at the end of the study, and they did find associations between learning different CBT skills to use and reductions of their symptoms. So, from our assigned reading and further independent research, cognitive behavioral therapy is highly effective. It has been adapted to meet the different needs of the populations that it serves. Delivery methods have improved greatly over the past few years, allowing CBT concepts to be more accessible to more individuals. It is one of the most researched treatment modalities, but according to my personal research and previous academic readings on the topic, it proves to still be very effective, and better results can be obtained when combined with other treatment modalities. So as always, there is need for future research as new options and new data and more interventions are always being developed. Alrighty, there are my references. I have also attached a document with my script. Thank you.